This is Dr. Biernacki, and today I'm going over leg ulcers, venous ulcers, arterial ulcers, swollen legs, wounds. We're going to show you all the best treatments, why it's happening, and all the big tips and tricks to get your swelling and wounds healed up now. If you're in America, we've got great wound care home services. We can help. Check the links below. We come out to your homes. We can do all types of wounds. Let us know if we can help. And at the same time, I have a wound care book, the 23 simple steps to heal your foot and ankle wounds, even though we do whole body wounds at the same time. That's the foot and ankle specific one. Check out that below. I've worked really hard on it. And if you're in Michigan, come see me in person. I would love to help you out.
How do you develop vein problems? Well, initially on the right-hand side, you can see great working valves. The blood can't flow back down towards the feet once it moves up, but with more weight, more damage, more standing on concrete floors throughout your life, the valves stretch out and you can't flow back down. That becomes a varicose vein. That can lead to blood clots. That can lead to spider veins, varicose veins, lymphedema, venous insufficiency, and then eventually a venous ulcer. One way to help that is things like compression socks. You can see it squeezes the valves back together. So stage 1 is spider veins. Stage 2, you develop more aggressive varicose veins. You can develop edema, leg swelling, serious skin changes like discoloration. And then towards the end, you develop leg ulcers. So this is what a pretty aggressive venous ulcer looks like. This is what 1% of adults develop.
Venous leg ulcers are unfortunately extremely common. They're quite bothersome. Millions of people get these. What is a venous ulcer? If your legs are too swollen through venous stasis, venous insufficiency, this develops a chronic wound because the blood circulation doesn't actually get to the edges. So arteries bring your blood flow down and veins bring your blood flow up. If you don't have enough coming up, that's kind of like being on a traffic jam. So arterial blockage is kind of like the highway being shut down, but venous ulcers are kind of like a traffic jam on the highway. So when you're swollen, that's more of a venous ulcer that can develop due to lack of blood flow to the edges of the skin. Whereas an arterial ulcer, that's kind of like a blockage or arterial sclerosis.
Arteries are always shown in red, but veins are always shown in blue. Arteries pump blood away from the heart and veins bring it back. So a good way I like to think about it is if you have a venous problem, you have a lot of swelling, the highways are backed up. If you have an arterial problem, your legs aren't necessarily swollen, but they're white, they're cold, they're not getting enough blood flow down to the foot. Check out our video on artery disease problems and blood clots, but right now we're focusing on the 5-stage spider veins, varicose veins, swelling, chronic insufficiency, lymphedema, and specifically how to take care of venous ulcers.
Venous stasis or insufficiency or even lymphedema. This prevents the blood flow from getting back up to the heart. Even though lymphedema is a little bit different, we have a video that talks about lymphedema specifically. That's if you have hard, scaly skin.
A lymph vessel is a third type of drainage system. Essentially, lymphedema is different than the venous system, and this can cause to really swollen and puffy legs with scaly skin. Check out our video on this below.
As a result, blood pools, and you develop blisters, openings, usually around the ankle joint. According to studies, millions of people suffer from this worldwide. The Journal of Vascular Surgery says approximately 1% of people, which is a lot, will develop a venous ulcer during their life. So that's about 2.5 to 3 million people in America right now with venous ulcers. In Europe, same kind of thing. 1.5% of the people in the population will get this. In Australia, same thing, about 1.3% of people. So very, very common, and it's only going up. This is a horrible disease, and it's very common. And what's worse, you're more likely to get blood clots, pulmonary embolisms, heart problems. If you have a blood clot or you think you have one, check out our video on blood clots below. So venous ulcers versus arterial ulcers. These are two different types of wounds. As I mentioned, if your blood flow is not getting down to your feet, that's an arterial problem. But if you're swollen, congested, congestive heart failure, or swollen, achy legs, that's more likely to be a venous ulcer. Venous ulcers usually occur around the ankles or the legs, but arterial ulcers are more likely on the feet, the toes, and they tend to ache a lot more. Venous ulcers ache with more standing and walking. Arterial ulcers hurt more at night, especially with your feet kicked up in bed. So an ulcer, a lot of the times it's scaly, crusty scabs. It's not actually a wound, but if you have scaly crust, you have to consider that as an ulcer. That's dangerous. And what happens is that's the scab that develops first, then that scab becomes a big hole. I've seen people just accept this and live with this. Don't. This is as dangerous as having cancer. If you develop a leg ulcer, realistically, your 5-year expected lifespan is low. You have to get this treated. This is so dangerous. The inflammation in your body increases. I consider this an emergency. As soon as I see these, we gotta race and get these healed up as quick as possible. And I'm gonna go over treatments here, but the book goes over all these in detail because you don't wanna take chances with this. Venous ulcers don't hurt as much as arterial ulcers. Sometimes they're not even very achy because people are numb in that area, but you have to take it very seriously. So it's a venous ulcer if your legs are puffy, swollen, they swell more as you're standing longer, you have discolored skin, hardened skin around your legs. That's not normal. That's the start of an ulcer. And then it eventually becomes an open wound or a sore. Therapy for a venous wound, here's what you have to start doing first. Number one, always check with the doctor. I can't emphasize that this is an emergency enough. We provide wound home care. Check it out below. It's covered by almost every single type of insurance. You can come see me in person. There's a lot of great doctors. But what you want to start with is, number one, you have to get great support for your feet. Most people, their ankles are bending out. It's stretching all the ligaments on the inside of their ankles, their knees. Simply wearing proper shoes, proper insoles makes a huge difference. Automatically your swelling will come down. Now, I link my favorite shoes and insoles down below. Always check those out. That can make a big difference right away. That's a simple, easy thing. One of the shoes I love is OrthoFeet. OrthoFeet is a great company, and hey, I actually work with OrthoFeet. This is not a shoe for everybody. This is more on the maximalist end. It's a supportive shoe with a lot of cushion throughout the heel. This works best for people usually over 50 that need support, that have some tightness through their hamstrings, their lower back, their hips. This is a great shoe. They make both slippers, they make heel supportive shoes. They kind of meet all these criteria. And you can see the insole inside the shoe is removable. It does an unbelievable job. It gets pressure off the heel, the arch. I love OrthoFeet. I have a lot of patients that wear them. Listen, they are an orthopedic shoe. They're not a lightweight shoe. They are for people with severe ball of the foot pain, heel pain, arch pain, ankle pain. If you have tight, stiff joints, this is a phenomenal shoe that's very high rated. They're actually the #1 orthopedic shoe. Check down below for the links for OrthoFeet. This is one I really enjoy and I really like. And what you also want to do is you don't need to wear big, heavy shoes all the time. There are supportive slippers, sandals that you can wear. This makes a big, big difference in getting pressure off your feet. Have something supportive pretty much all the time until the swelling and pain calms down. And gradually you want to do this for at least the first month or two until you can start walking with a little bit less support, getting your knees and hips stronger. You want to get a biomechanical exam. If you have a bad hip or a bad knee and you're twisting, you're leaning on it, you're going to overuse those joints and it's going to swell. That could lead to an ulcer, especially if it's one side worse than the other. Number two is you want to check out your heart, your diabetes, your health conditions. If you're overweight, getting that stuff down obviously makes a huge difference right away. In a month, you could change your life just by getting those health issues under control. Compression socks. Compression socks, you don't need a prescription. You can buy low-cost ones online right now. I link those below. That can make a huge difference in getting your swelling down. At the same time, we as doctors can write you a prescription, but it's easier just to start with 10 to 20 millimeters of mercury. I have a video going all over compression socks. Do they work? How to go ahead and buy them? What are the tips and tricks? Can you sleep with them? I go over all that in that video.
Compression socks improve circulation, reduce leg swelling, help prevent blood clots, enhanced athletic performance, help with leg pain, and it helps with certain jobs like nursing.
And elevation. When you're in bed, the recommended sleep position is on your back or on your side. Ideally, if you're on your back, you want to get a pillow under your feet. All that swelling will decrease while you sleep, while you're on the couch. And at the same time, you want to get up. You never want to sit for more than an hour without getting up for at least 1 minute and standing. That's kind of the trick. Blood clots happen a lot on airplanes or long car rides, but now people sit and watch Netflix for longer than plane rides even go. So do the math on that. If you're sitting for more than an hour, 2 hours, that is dangerous. You got to get up and move, get that blood flow circulating. Exercise. If I could give a tip to everybody, there's a great book on how to live long that goes over all the studies. By far, number one was doing just a few minutes every week of strength training. So push-ups, sit-ups, air squats, strengthen your muscles. That's the single biggest contributor to great health, but that exercise will raise your good hormones and get your blood flowing. And the next thing is you want to get a little bit of cardio beyond the strength training. The second biggest factor towards long life and great circulation is your aerobic capacity and how well you function. So go for walks. Go move around your house, even back and forth to the bathroom once an hour. It makes a huge difference for a lot of people. Not moving and sitting for long periods of time has been statistically shown to be even greater than smoking versus non-smoking. That is huge. Exercise should be promoted on every channel, every pharma commercial, because exercise is way more proven than any medication. So wound care. When you come in, compression therapy, so compression socks, the Journal of Vascular Surgery showed that venous and lymphatic disorders in about 40 different trials, if you can wrap these, huge rapid improvements. Not only does it shrink the wound down, but it speeds up how quick the wound heals. So if you can hold it with a wrap for a few weeks and that wrap makes the wound smaller, and then that pressure gets that blood flowing through it, that will heal pretty predictably. In the office, I use something called an Unna boot. This is a zinc oxide moisturizing layer. So essentially, I'll clean up the wound, spray it, put medication on it, put the proper dressing on it, and I'll wrap it with a moisturized layer all the way from your toes up to your leg. People right away, their legs shrink down to like half the size. They feel a lot better. People who have had this wound for years, within a couple weeks, it starts closing down like 50%. It's crazy how rapid the results are. You feel better, your fatigue goes away. So if you're in that 1.5% of America, or about 2 to 3 million people, go to your podiatrist and get this wrap, get it checked out. It's literally so straightforward for most people. It works so well. We'll even come out to your house and do it. A study published in the Wound Repair and Regeneration Journal showed that an Unna boot makes a massive difference compared to any other dressing, speeding up the healing. Topical ointments. Studies show that this works extremely well. A moist environment, moistening that scaliness but not too wet, can make a huge difference. So we do hydrocolloid dressings, which are proven in the Journal of Nursing. Silver dressings, these are antibiotic ones that control the bacterial buildup. Honey-based dressing, yes, honey actually kills bacteria. Too much sugar is bad for us and it's bad for bacteria. And collagen dressings, these soak up moisture. And guess what? Insurance does cover growth factors. It does cover skin grafts. So if we do all that and you're still not getting better, we will actually come out to your house and do skin grafts, or you can get that done in the clinic. This is not a wound you have to live with. This is something we can help you. Check out our book on the 23 simple things you can do right now to heal up your ulcers, to start feeling better. We have a ton of studies, a ton of clinical-based evidence, and I worked really hard on this, and we'd love to come out and help. This is such an epidemic. 3 million people in America, and even more around the world, should not be suffering with this. So let us come help. Check out the links down below. If that didn't work, there's surgeries to clean it up, skin grafts, there's blood flow testing. So if your blood flow is not getting down to your toes, even though that's an arterial test, we'd love to do that blood flow testing. We can do that out in the house through an arterial brachial index. And get those shoes, get those orthotics, get that biomechanical exam, get your heart checked out, get checked out for diabetes. All that makes a huge difference. And if that didn't work, wound care. Wound care is huge. Like I said, we provide home care throughout America in a lot of different locations. We come out to your house. You can come to our clinics if you're in Michigan. I would love to be able to help you out with that. And check out our book on the 23 simple ways to fix your foot and ankle ulcers. It'll make a huge difference. I'd love to be able to help you. If this helped, give us a thumbs up, give us a comment, tell us what else you need help with.